Hi there, my name is John White. I'm one of the consultants in genitourinary medicine, which is also known as sexual health medicine. And we've got a clinic here at Alton McGelvin. Now, sexual health medicine or genitourinary medicine deals with conditions such as sexually transmitted infections. We also do a lot of testing and treatment for infections such as HIV. We do contraception for women, and a lot of people who have any other complaints that might concern their sex lives or their genito-anal areas, but anything that you're worried about that you think might have something to do with sex, we're very happy to see you. At the clinic here, we have a walk-in clinic Monday, Wednesday and Friday morning, so you can just pitch up, preferably before 9 o'clock. The queues can get quite long, but we can usually see you same day. Otherwise, you can phone the clinic and make an appointment, or we can advise where the best place to be seen will be. But we have the clinic here Monday to Friday at Alton McGelvin. It's in Anderson House, which is where the dermatology clinic is, so it's apart from the general hospital, and it's an open access, and we're very happy to see anyone who wants to come and see us. Men and women, gay, straight, old, young, whatever your concerns, then you're very welcome here. Just to give you a bit of an idea, when you do come to the clinic, if you don't have any symptoms, it's usually pretty quick and easy. We just want to ask you a few questions to see what kind of things you might be at risk of. And then for men, it's usually just a urine sample and a set of blood tests, which we just take from the arm. For women, we usually get you to take your own swab. So we don't have to look at you or touch you or do anything like that. You take the swab and we get some bloods as well. For men who've had sex with men and other people who may be at risk, we sometimes take a throat swab and an anal swab as well. But they're all very straightforward and they're very accurate tests. And much easier than what people think. A lot of people, particularly young guys, they all think that you're going to have something really uncomfortable done to you. There's this thing called the umbrella test that people have heard of, which never actually existed. But don't worry about that, we're not going to do something that's too painful to you. So most people, when they come in, they're pleasantly surprised that it's not as bad as they thought it was going to be. When you come in, we'll sit you down. Everything is as confidential as we can make it. This isn't linked to your GP record, it's not linked to your hospital number. Some people don't even use their real name when they come in, to be honest, but as long as we can identify you and contact you, that's all that's important. When you come to the clinic, we'll sit you down, have a chat, find out what you're here for, ask you about any symptoms or problems. We usually ask about what's been happening in your sex life, as well as any other medical issues. And then if you do have any symptoms or problems, we may need to do an intimate examination, but we do that in a very comfortable and professional way, and we can take specimens that we can look at straight away here in the clinic, in some cases, so we can usually tell you if there's something going on or not. And then we also send tests off to the laboratory where they do specific tests on swab samples and blood tests and urine samples, and tell us whether there's any infections present or not. Depending on your other concerns, for women we do all kinds of contraception, including the long-acting reversible contraception, so injections, implants and coils. We can provide all of that. We love giving away free condoms and lube as well. Results are usually back within 2 weeks, most of the time before that, so sometimes people might be waiting until they get the all clear from their results, but if everything's okay, we usually just send you a text to your phone, and if there's any concerns or problems with your results or anything that needs treating or repeating, we'll give you a call and make the time for you to come in and get that sorted out. But for the vast majority of things, we can do it all in-house at the same visit. For some people who have ongoing problems or recurring problems, we can book them in for follow-up appointments as needed to have those troubles sorted.